he is known for his exceptional talents in creating natural, rejuvenated smiles. It's the first thing people see, right?
It's important.
We say it all the time. It really is.
That's right.
He's got this new technology to tell us about today.
We're joined by Dr. John Heimke from the
he.
Facial Aesthetic Designers. Yes, yes, he is the he, and he always comes fashionably dressed.
Oh, well, thank you.
Yeah.
So for those who don't know, what is DSD?
Well, DSD in 2018, it's been around for about 10 years, but really in 2018, it's the new face of dentistry.
Okay.
It's more human, it's more artistic, and more emotional. And using technology, we can be a lot more precise, and also we can be very efficient in what we're doing as far as creating the smiles.
We're seeing some footage right here. How has this benefited your patients' smile results?
Well, what we're able to do with DSD is I'm like an architect of the smile, and what I'm able to do is share with my laboratories down to the 100th of a millimeter of, you know, the shape of the tooth, the contour of the tooth. We're actually able, like you're seeing in these videos here, we're able to test drive a smile on patients' teeth before they even get the work done, and look at the expressions on their faces. You know, they're like seeing what this possibility could be. This is called a mock-up smile, or a pop-in smile, or a test drive smile, whatever you want to call it. But what it is you're actually able to put it over your own teeth before you have the work done and kind of visualize where you're going to go with it. And it's based on a design that I create, just like an architect, and I can share it with my specialists. I can share it especially with my laboratories, and we're all on the same page. That's how we get a really natural-looking smile that's in harmony with the face, because we use the face so that we can create that smile that's just for that person.
So what do some of your patients say? Like, how would you say DSD benefits them?
Well, it benefits them compared to the old way, in that it used to be that we would design a smile, we'd try it in, then we'd redesign it, and all the way through the process. Now, we're able to carry that design from the beginning, and my vision of that smile, based on interviews with the patients, goes all the way through the treatment.
Okay.
Who should be looking into these services? Because there's a lot of you watching today that are curious if this is for you, I'm sure.
Well, this can be for a patient that is, you know, they're just unhappy with their smile and they want maybe simple whitening, to somebody that wants, you know, shape changes. We can even do something called a smile donator. So let's say you like somebody else's smile, and we're able, like a relative, and we're able now to scan that relative and then give you basically their smile in your mouth.
Are you kidding me?
It's called Smile Donator. It's a really big thing with DSD. Or we have libraries of natural teeth from people that have, you know, basically donated their smiles in a library of smiles, and we're able, if somebody says, geez, I really like that smile, I can take it and I can put it in your mouth and you can test drive it, and then I can make it into porcelain veneers.
Well, and the cool thing about what you do is that you could actually show the patient what that smile would look like before they get it.
Exactly.
Right.
And
That's
it's
so
more that
awesome.
we can do it in a picture format, but even better, we can do it live in their mouth.
So it's not like you're guessing.
Wait, what do you mean live in their mouth? Like,
what we're able to do is we're able to make the design, and then I'm able to put it over your own teeth.
Really?
And then in about 3 minutes, take that out, and you can see, we usually take a video and show you on a big screen TV because it's really cool.
Yeah.
And you kind of sit back and we kind of see you before and see you after. Then we just take it out, and then the patient can say, geez, I really would like to get that done. And then we do it, and we basically do it in real life.
This is a whole nother level.
It really is, and that's what I was just going to say, is it's so groundbreaking. What's next? I mean, where do you see this headed? Just because you are really, I feel like,
well,
at
what
the
we're doing
forefront of
now
it
is
all.
actually, it's going to happen in just a few months. We're going to be able to take facial scans, 3D scans with our iPhone. So in other words, instead of just a 2D photograph, we're going to actually be able to take the iPhone and scan the face and make a three-dimensional model of the face, and then we can put the smile right into that. And so that design becomes from more, instead of a 2D, becomes a 3D. And then what we do is we convert that at the laboratory into a printed model of the new teeth, and that's how we do the mock-ups, and that's how we do the final veneers.
Oh my
gosh. So there's really a lot of exciting things happening now as far as smile designs are concerned.
So who do you think should really be considering these services?
Really, anyone that wants to have a change, they should come in and have a consult, and we can talk about what their needs are. It might even be for somebody that's going to lose all their teeth and is going to need implants to be placed, and then have an implant bridge from one side to the other. So, you know, just because you're going to lose your teeth doesn't mean you can't have a fantastic smile, just like somebody that has porcelain veneers.
And all that being said, what's it like to watch the reactions of these people that you work on?
Oh, it's so gratifying. You want to come to work every day and watch this. It's changing dentistry. Like I said, it's more human and it's more emotional. You know, it captivates us in the office. We want to come in, we want to help the patients out, and we've all had our teeth done in our office, from myself down to my hygienist, to my front desk, to my assistant. You know, we've all had it done. We all have walked the walk because we've all felt that way, that we just didn't care for our smile.
Well, is it comfortable once it's in all the things that you do, like when you're putting the teeth and stuff like that? Does it feel natural?
It sure does.
See,
it takes a little bit of getting used to,
Right.
but give it a few weeks.
Like
and
a hot
then,
second.
Yeah, and then it's your own teeth. I've had mine for over 15 years, and I'm like, you'd never know.
And
right?
they look awesome.
They do.
And we use Oral Design ceramists. They're some of the best ceramists in the world. And so, you know, come and visit us, and we'll walk you through it.
Yeah, right there in Rocky River. You can call 888-255-3588. Go to everyonelovesmysmile.com or dentalimplantsrockyriver.com. Thank you again so much.
Pleasure. See you next time.
Good. Yes, we will see you soon.
Yeah.